This is a 20 years old male referred with the history of PUO for the last 3 months. No lab profile, no detailed clinical history, no other imaging modality facilities has been provided. And by just looking at his face and the abdomen is very tender, is giving a bowl-like rigidity that is clinically suggestive of peritonitis. It's a bowl-like rigidity. There is no history of absolute constipation or vomiting. Now let's see what is the issue. Let's see this. Now you see this is the liver, and the liver is giving a starry appearance, a black background with star-like prominent minor portal vein radicals, giving it a starry appearance. These are all prominent minor portal vein radicals. Now this is the gallbladder, this is the right hemidiaphragm. There is no fluid seen above the diaphragm. On the left side, we see that the spleen is normal in size, kidney is okay on the left side, but moving upwards, I can see that this is a part of the spleen, and this is the fluid, the ascitic fluid that is surrounding the spleen. This is again fluid. There is no fluid seen in the pleural space. The pleural space is, if there is any, if we say that this is small amount of fluid, then it is sympathetic. No significant fluid seen, kidney is okay, small amount of ascitic fluid is seen. Now you see, now from the epigastric region, I am moving the probe down up to the umbilicus, and nothing is seen except bowel gases, and this pattern of bowel gases from the epigastrium to the umbilical region and rather all of the upper abdomen is consistent with the peritonitis, developing peritonitis. Nothing is seen, everything is obscured because of this is the heart, no pericardial fluid. Now from here, it's very difficult to view the structures below, mainly the pancreas, the para-aortic lymph node, the phrenic. It's not easy to evaluate in this patient with excessive, massive bowel gas shadowing. On ultrasound, this is very much suggestive of keeping in view the clinical picture with that of the peritonitis. See the respiratory movements as well. Patient is having tachypnea. Okay, now coming towards the lower abdomen, what I see, that too from the angle, from the side of the patient, what we see is meager movement of the bowel segments in the left lower abdominal quadrant. This is the right lower abdominal quadrant, and you can see that there is, now this is the paracollicular in fact, and what we see here is that this is the bowel segment, and this is the iliopsoas muscle. This is fluid in it, and you will see that the bowels show meager, very slow peristaltic movements. And and then coming down in the right lower abdominal quadrant, this is the bowel segment, and this is the iliopsoas muscle. This is fluid in it, and you will see that the bowels give very slow peristaltic movements. And then coming down in the right lower abdominal quadrant, this is the iliopsoas muscle. This is fluid in it, and you will see that the bowels show meager, very slow peristaltic movements. And then coming down in the right lower abdominal quadrant, This is the urinary bladder. This is the urinary bladder. These are the bowel segments. And now see that this is a bowel. This is a bowel segment with trapped gas within it. And the bowel wall is regular, measuring approximately 6 mm. More than 5 is considered pathological. So there is a segment of bowel with trapped bowel lumen gases seen in the lower abdomen, right lower abdomen. This is the one, this one. So this is the bowel segment measuring 9.1 into 3.4 centimeter with trapped bowel lumen. This is the lumen and this is the air. Ecogenic area is the air, though no shadowing. However, you see this is the dirty shadow. This is the dirty shadow that you can see, and this is the regular wall measuring approximately 9.5 mm, and this pathology is very much consistent with now this is the right lower abdominal quadrant here. I am getting it from here. So this is a case of see the bowels. Hardly you can see movement in this segment. You see, concentrate on this region and you will see the movement of the food material, but it's slow. The peristalsis is slow. Normally we do not see this sort of picture. These are all matted bowel segments. Here, now on the left side, total left lower abdominal quadrant. Same picture, bowel segments, trapped air. What can we deduce from this two-mode ultrasound study is that there is matting of the bowel segments in the lower abdomen with the interloop fluid. This is a bowel segment, this is a bowel, this is a bowel, this is the fluid within it. So interloop fluid is seen, and you will see that within this fluid echoes are seen. This is a fluid pocket, and you will see echoes within it. And we did saw ascitic fluid in the left lumbar location and around the spleen. Here we see fluid with echoes and trapped bowel segments. You see, this is the fluid. This is fluid with echoes. This is bowel segment. This is the bowel. This is the bowel. This is the longitudinal section of the bowel transfer, and this is the fluid within it. So matted bowel segments with the appearance and history of the a verbal history. This is a case of peritonitis with with matted bowel segments in the lower abdominal quadrant. This is the left side. And you can see the movement of the bowel is so slow. And there is interloop ascitic fluid as well. So this is our case of the day, that is matted bowel segments in the lower abdominal quadrant with interloop ascitic fluid as well as fluid in the left Morrison pouch and around the spleen as well with toxic liver. Thank you very much.